my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, it used to be a sign of middle-age problem when you used to lose hair or have thinning of hair. However, with increasing pollution and the stress in our daily work life, we are now seeing young people also complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided. Today, we have with us Dr. Mithra Vasanth, is a well-known dermatologist and has been practicing medicine for over many years now. She's MBBS, MD, specializes in dermatology, cosmetology, and trichology. Currently, she's practicing at her own clinic, CUTIS PARASOL Skin Clinic, Chennai. Dr. Mithra Vasanth has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized hair care services to her patient. She takes time to listen to her patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Doctor is also aware for the patient need about awareness in hair and skin condition, and however she has given talks at many platforms across different platforms. Dr. Mitra is also aware for the need for the patient education, so she has actively participated in creating those platform very well known. Doctor, आज हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया. Welcome to this YouTube live show.
Thank you, Ms. Mona, and thank you for a kind introduction.
Doctor, today we are going to talk about like hair care in current scenario. So whenever we talk about hair care in current scenario, the very common problem which is faced by all of us like is hair fall or hair loss. So can you please enlighten us with your profound experience, like what's normal and when to be concerned for?
See, there's I would like to rephrase this hair loss and hair shedding. Okay, so hair shedding is something normal where about 10 to 20% of your hair will always be in shedding phase. That's a very normal cycle of a hair. Some amount of hair will be in growing stage, some will be in resting stage, some will be in shedding phase, which is likely 10 to 20%, approximately 50 to 100 hair strands per day. It can fall. It might fall. That is quite normal. When the hair fall is like hair shedding is more than 100 for a very long time, making your scalp visible, and it's like your hair is becoming very thin, and you feel people start asking you that, see, your scalp is visible, are you facing any issue? That's when you're actually getting into trouble, and that's when it's called hair loss, and you need to meet the dermatologist for that.
Okay, that's very interesting. Like when everyone at your home start complaining your hair is everywhere, why don't you
But
do
sometimes that might be, some patients might have very normal hair shedding only, but they might be really concerned about it, stress too much about it, and really worry and cause more hair fall. It might be normal also. So you need to meet the doctor, give a clear history for them to identify whether it is a concern or something normal.
That's very interesting, doctor. So, doctor, like when the person is going through these hair loss, which is like after diagnosis, they come to know that, okay, this is hair loss, which is I'm having, and it may get me to have a baldness. But then they also curse themselves, like, why it is happening to me. So, what are those general causes of hair loss?
See, when it comes to men, generally what they face is androgenic alopecia, which is the male pattern balding. For them, it usually it depends upon if they have a very strong family history where even their father or maternal uncles have a history of balding, they might. Or some people even without the history, their lifestyle induced, all that can aggravate the hair, balding for men. It usually they do not have hair fall as such men. What they face is the hair, there will be receding hairline, and the thickness of the hair gets reduced, so the hair becomes very thin. That's how the scalp gets visible. That's majorly for men. For women, it's more of more onto the telogen effluent we call, which is just some stress induced or something which has a recent surgery or weight loss can trigger a hair fall. That will settle down with proper supportive treatment, where again they need to they need to follow a very good healthy diet. If they need any serums as a supportive treatment, yes, we might prescribe. That itself, you can, if it is extending for a very long time, you can call chronic condition, the telogen effluent. And for women, there's something called female pattern hair loss, which is more common when they are in perimenopausal age or menopausal age. And also, if they have PCOS, they might have this visible, scalp because of excessive hair thinning.
Okay, okay, that's very like proper way of feeling those causes, and it's always better to go to the doctor and ask them instead
Yeah,
of
right.
getting.
Whether what is the cause, whether because not everything needs a very aggressive approach. Also, something will seasonally be there or it will settle down on its own. You just need to meet the doctor whether you need any support or not.
Okay, interesting. So, doctor, nowadays we have all like very busy lifestyle where we don't pay attention to what we eat and what time we sleep, or and what is we are feeding to our mind. So, can a person lifestyle play a role in hair loss?
Definitely, lifestyle plays a role in everything in your body. Skin and hair is the telltale of a person's health. Okay, they might think they're eating really well, but they might skip, certain nutrients which are required. They might have even a lot of patients have this issue. They have normal hemoglobin, but they say, "Why am I having hair fall?" But
Mm-hmm.
basically, for the hair growth, hair is an accessory organ. Okay, so for the growth of hair, everything goes from the reserve. So the patient might not have enough iron and ferritin for the hair growth to happen. So these all and they sleep. Sleep is one of the major role. They have to have at least quality sleep of at least 6 to 7 hours minimum. 7 to 8 hours, very good. And the timing also varies. You need to have follow the biological clock and the lifestyle also includes their habits. A lot of hair treatments, a lot of chemical treatments again can trigger hair fall. Or if they have wash their hair very less. Number of times the frequency is very less where they allow the dirt to collect, the sebum to collect. That might cause inflammation and dandruff. So it's like washing your hair regularly. Hair oil
Mm-hmm.
is more of a moisturizing factor. It is not actually not going to cause major difference. And then they need to use a good shampoo and a conditioner on a regular basis. A lot of patients, when you come and ask, "Are you washing your hair regularly?" Yes, it's mainly men. Okay, so what shampoo are you using? No, I don't use any shampoo. I just wash my hair. No, you need a shampoo to cleanse your scalp and hair. So these factors and healthy diet. Okay, so
Mm-hmm.
minimum of 3 vegetables, a bowl of fruits, nuts, all that has to be taken on regular basis with a good quality of sleep, physical activity. All that plays a major role. If these are not there, any of the thing is compromised. You can see it on the skin and the face of the person. Hair also, it really shows.
Yeah, doctor. Yeah. So actually, not in only metabolic lifestyle disorder, also hair is important, and so the lifestyle also play a role, and we should pay attention to that. So now, the doctor, we know what's hair loss and what are the causes. So another very common question, and because of era of information, people are quite confusing what is the right treatment for them. So can you please enlighten us today, like what are those medical treatment
Yeah, the treatment
options?
depends upon one's, like cause of it. Okay. But for a person with an androgenic alopecia where male pattern balding, depending upon the grade, we need to treat them. If it's in the
Mhm.
initial stage, we just give them a serum and ask them to follow it regularly. Or if it is in little, as the stage increases, the treatment might vary. We might have to put them on oral supplements. We might have to, need give them some treatment procedures for hair regenerative medicine procedures that where we give them the growth factor injection, concentrated injection, PRP and PRF, all that can be done, and even exosomes are there recently. And sometimes for a patient who's got allergy to these serums, we give them oral minoxidil also. So it varies depending upon the cause. If it's a female patient, we need to address the cause. Basically, it depends upon the cause. I cannot say this is for this person, this is for that person. It
Mm.
depends upon each person, their lifestyle also. For some person, I might give a serum, but their lifestyle may not permit them to apply serum on everyday basis. They might not. They'll be traveling a lot. If that's the case, I have to give them oral medication of the same. So it varies. And for women, mainly for a PCOS female with a hair shedding, we need female pattern hair loss. We need to concentrate on control of the PCOS also, because that is major cause. So we need to treat that so that the hair shedding will get. I mean, hair balding will get better for her, and we need to give her treatment appropriately. So surgical intervention. When it comes to surgical intervention, it's hair transplant. Again, it depends upon the grade, and it also depends upon whether the patient is eligible to get a hair transplant. It's not like anyone can get it. We are going to transplant hair from this hospital lobe to ear. Whether the hair quality is good enough there for it to grow in another place, we need to assess the patient, their other comorbidities, and how far are they compliant in following. Because once you do the transplant, it's not like it ends there. The hair is
Mm,
not going to stay there without any maintenance. They need to do some maintenance treatments also, which includes continuing the serums or tablets or getting hair procedures now and then. So all
mm.
these depends totally upon the patient's cost and the grade at what the grading the balding is.
Okay, okay, that's quite interesting, doctor. So it's a customized treatment.
Yeah,
It's
you
not.
cannot. Yeah, I cannot just put it for what all are they.
Yeah, and we cannot just buy we saw a serum and we buy and start applying it, and instead of not asking a doctor. That's interesting, doctor. So now that we are talking about treatment, there is one word called nutraceutical, which is getting a lot of focus. So what is this nutraceutical, and is there any role of this nutraceutical in hair health?
Nutraceutical plays a role when the patient is hair balding or hair loss also has this nutritional deficiency factor,
Mm-hmm.
and so that has to be and sometimes patient and one more the one which a lot of patient talks about is collagen. Yeah, collagen is good for skin, hair, and nail altogether, but
Mm-hmm.
for a person with balding, just taking collagen is not going to treat the hair fall or hair growth. It's not going to cause. It's going to be a supportive treatment. So nutraceutical is just a supplement, a supportive thing. It cannot be a standalone treatment for hair fall or hair loss.
Okay, okay. So it's so, doctor. Like people say that these plant extract like phytoconstituent or these omega-3 fatty acid. Do they really helpful in management of
See, just
alopecia?
take as well again as I told you, taking only omega supplements or these plant extracts as a sole treatment is not going to do. If you're a person who's eating healthy, you will get all these together. If it's a healthy, balanced diet, you're gonna get all this in your diet through your diet itself. So just taking omega supplements, I cannot say the patient is the hair fall is gonna stop, the hair loss is going to stop. It's gonna be a collective, a combination of vitamins, minerals, plant extracts, and everything. So which if a person is really good with their diet protocol, I think there'll be no need for these supplements unnecessarily. And
Mm-hmm.
there are patients for whom we give supplements. We feel there is deficiency. It has to be addressed immediately, yes, for a short while until it gets corrected. You cannot keep bombarding your body with a lot of supplements because there's something called toxicity also of that. So there are
Mm-hmm.
patients who keep taking tablets thinking they have hair fall. But
Mm-hmm.
yeah, you need to really have them, keep like they have to meet the doctor and ask them how long they're supposed to take and not keep. They cannot keep consuming the supplements without any guidance.
Okay. Okay, that's interesting, doctor. So, doctor, like there are so many nutrients like macronutrients, micronutrients. So, like what are those nutrients, and is there any role of these micronutrients in
Yes,
hair
yeah,
health?
your iron, ferritin, vitamin B12, vitamin D3, zinc, calcium, magnesium, everything plays a role in your hair growth. So
Mm-hmm.
when usually when we check a patient for hair fall, we usually ask them to do the basic panel like iron, ferritin, vitamin. That will give us a fair idea that okay, they're having deficiency of everything. So when the supplements are given for the patients, we give everything all together, what the hair requires, how much of the RDA requirement, how much is it, depending upon that only. It's the combination of these vitamins, mineral supplement only. So it's not like you want to take only magnesium tablet or zinc tablet, nothing like that.
Okay, okay. So everything is important, every vitamin and minerals, and we should pay attention to our what we are eating. Interesting, doctor. So, doctor, apart from hair loss, there is another very common problem which is faced by all of us is dandruff. So, can dandruff also cause hair fall?
Yes, definitely. In a way, dandruff will aggravate hair fall because dandruff is an inflammatory condition. It's basically, again, it is lifestyle related. If you're not going to wash your hair regularly, you're eating unhealthy, your sleep hygiene is very bad, you have other comorbidities like, obesity or diabetes or anything, it indicates your lifestyle is little unhealthy. So,
Mm-hmm.
and if you do not wash your hair or you keep applying oil, you go out, you sweat a lot, there's a lot of pollution, there's a lot of dirt gets collected. So altogether, these will cause inflammation, and that's when they get dandruff. Okay. So
Mm-hmm.
dandruff is something what patients need to understand is it's not something we give the patient is treated forever and it's gone forever. It is not like that. Almost on everyday basis, the sebum secretion is going to be there on your scalp. So it's all about you keeping it under check, under control. You need if you have an oily scalp, you have to make sure you wash your hair frequently. Use an anti-dandruff shampoo to keep it under control. Correct your vitamin D because vitamin D deficiency will aggravate dandruff. So, since it's an inflammation condition, it's going to affect the scalp health altogether. So that way the hair fall will get aggravated. So that way it is going to cause hair loss.
Mm-hmm. Mm-hmm. we Indians are low in vitamin D. So yeah. Anyways, so doctor, apart from like we talked about lifestyle and we talked about how the nutrition is important. Apart from this nutrition, we one more thing which is faced by all of us is stress, and we are like all, and it's not avoidable. So is there an impact of stress in our hair health?
Definitely. It goes without, I think I don't even have to answer. Everyone knows stress, it aggravates the hair fall. Definitely, it has a major role. Sometimes the patient might not even have hair loss. They think they have hair loss. They keep stressed about it, and then again, that's the reason for the hair loss again. Definitely, it plays a major role because it affects the dynamics, hair dynamics, the growth cycle of the hair. If stress is there, you're not concentrating on your lifestyle. So it's all like a vicious cycle. One affects the another, and it just goes on and on. Definitely, it plays a major role.
Yeah. Okay. So it's important to manage our stress.
Management.
Okay.
Yeah.
Yeah. So, doctor, like you said that oil is for this condition, and but since our grandmother and great great grandmother, they always give us used to give this formula like apply oil, get the massage, it will help you to grow your hair faster, longer, and thicker. So, what's the fact behind this? Oiling hair is boon or a ban?
See, when you oil your hair, you can apply oil to the hair strands alone, not for your scalp, because your scalp has its own enough amount of sebum. There's no point applying oil there. You can apply for your hair, leave it for a short time, like a conditioning effect, and wash your hair. Maybe once in a week, 10 minutes, you can apply for your hair strands alone and then wash it off. But as it is for growth, it doesn't have major role. But if your hair is good condition, there's no frizz, your hair structure gets maintained. So the strength of the hair is better, so that way the hair shedding, all that will get better. Okay, so it's more of conditioning. Yes, you can use it for conditioning effect, but not like on a regular basis, applying it and going outside and all with all the pollution and dirt around. You're actually aggravating your dandruff as well as your hair fall.
Okay, okay. So you cannot apply a lot of the oil and sleep and
It's
think.
only for no need overnight application also.
Okay, okay, interesting, doctor. So now, doctor, my favorite part. Can you give us some important tip for healthy hair?
Healthy hair. Okay, so make sure you take at least good amount of nuts on everyday basis, because it has all the essential vitamins and minerals and all the macronutrients for your hair growth. Okay, and generally off late, the major complaint which we face is a lot of patients doing a lot of treatments for the hair. If you avoid taking frequent chemical treatments for the hair, because there's all, and there are patients who go there, they already have hair fall and they get this treatment, it's going to worsen it further. Okay, and if you have hair fall, just changing your shampoo alone is not going to do anything good. Okay,
Mm-hmm.
shampoo's job is to cleanse. So if you you have to address the cause of the hair fall. Okay, so you need to go meet your dermatologist and get that sorted. And sometimes, whether it is hair loss or hair shedding, you need to talk to your doctor and find it out, because sometimes normal fall itself, patients get concerned. Okay, and fifth, hair is a telltale of your overall health. Okay, so if anything, if there is abnormal hair shedding, you need to really take care of your overall health. Your doctor might investigate for everything, your thyroid, sugar, even your whether your vitamins are normal, everything altogether will indicate. And just because your hair is an accessory organ, it is one thing which really affects the confidence of oneself. So you need to, before even if you plan, you're someone who's really bothered about your hair and thing, go meet the doctor at initial stage, because going at a very later stage is going to really waste. It's like the treatments might take longer time, the response is going to take a longer time, and until then you need to go that stress, you need to go through all the steps. So anything it's bothering, go at the initial stage itself. A person with balding, don't go in grade 3, grade 4, where you need a hair transplant, you need procedures. That's when we can really give response to. As your age increases, the treatment for response also goes down. So please go at the initial grade or initial stage itself, so that things can be handled with little intervention. Yeah.
Thank you, doctor. This discussion was very informative, and I'm sure the viewers have found the session very helpful. So, can I take some one or two live audience questions, doctor?
Yes, please. Yeah.
Hi, doctor. My father have alopecia, and I'm 35 years old. I see hair loss gradually in my head. Is it going to happen with me also? I will be also diagnosed with alopecia. Is there any way I can stop this?
See, is it alopecia, androgenic alopecia? Is it a male patient or a female patient?
Male patient,
Male
please.
patient. So if he means there's balding, your father has got balding, yes, there are chances of him, getting balding, higher chances of him getting it. But see, if it is just in the initial phase, you can go meet your dermatologist. They might guide you with just serums so that you don't have to go, you don't have to really face anything in future.
So, doctor, is it like genetic? Like,
Yeah,
is
definitely. Male pattern balding has a genetic role, definitely. Even all kinds of balding has a genetic role, even female pattern hair loss.
okay, okay. So, if someone have a family history, they should always consult the
Yeah,
doctor.
they see, yeah, that's better.
Okay, okay. That's so stay
So it's like
vigilant.
if your dad got at 35, you can expect at 20 itself for you. That's how
Mhm.
it is going to be.
Okay. Okay. Another question from our viewer is, Hi doctor, I'm also from Chennai. How to get your appointment? My daughter is 12 years old and she has a lot of white hair. We applied all home remedies, nothing is working. Is there any way to stop why she has gray hair at such young
So
age?
graying of hair at an early age, either they should have a family history again. Whether
Mhm.
the parents has a family history of graying, you need to rule out. Sometimes, along with family history, patient will have nutritional deficiency. There are three categories of patients who have this early graying. One purely family history. The another they'll have nutritional deficiency. So we have to do the nutritional workup. If
Mhm.
anything is low or deficient, we need to correct it. If it gets no, I mean once it gets normal, further graying can be stopped. The hair which is great, really nothing much can be done. Third
Mhm.
category, they might have both family history and the graying of hair, I mean, nutritional deficiency. For such patients, we cannot stop the graying, but we can reduce the burden of graying by correcting the nutritional deficiency. So, the person, I highly recommend them to go meet a dermatologist so that they can prevent further progress if there is nutritional deficiency. Yeah.
Yeah, and doctor's clinic name is CUTIS, PARASOL Skin Clinic. So you can always Google and find for her appointment. Okay, I'll quickly take one more question, doctor. So, she's saying that, Hi, doctor, I have PCOD, and since I diagnosed with PCOD, I'm having a lot of hair fall. I changed shampoos, conditioner, but nothing is working. Can people with PCOD also can stop hair fall?
See, yes, I think she has told the point which I already told you. Just changing the shampoo and conditioner is not going to do anything good for your hair fall. So, if PCOS is the cause of hair fall, it is going to be like a seesaw where the PCOS also has to be under control, and so that your hair fall can be under control. You
Mhm.
go meet a dermatologist, you're getting treatment done, your hair is growing, but still, if your PCOS is not under control, again the hair shedding is going to happen. So, to put it in a very simpler terms, PCOS is like hormonal imbalance where a female is having little hormonal imbalance where the male-based hormones are little going it's a little high. So they
Mhm.
start balding like men over the scalp and they start growing hair like men over the beard area, mainly facial area. So it's about make sure your cycles get regular. Go meet your gynecologist if your cycles are abnormal, it's not proper. Work on your lifestyle changes where weight reduction and doing physical activity. And parallelly, you need to get your hair fall treated, okay, so that everything gets maintained. And PCOS, it's again a metabolic condition, so it's all about keeping it under control. If it goes for a toss again, your hair shedding, hair thinning will go again. And please meet the doctor at the earliest possible. Yeah.
Okay. That's very interesting, doctor. So, doctor, finally, would you like to go with any take-home message to our viewers today?
I think I've told enough. It's just that you just need to, if you are in doubt on anything, please meet a dermatologist for your hair, skin, and nail consent. Yes.
Yeah, so early intervention is the key,
It's the
and
key. Yeah. Early intervention is the key. So that you don't want any procedures, go meet the doctor at the earliest possible. That's it.
thank you so much, doctor. Thank you for sharing all your expertise with us today, answering all the questions of our viewers today. I'm sure the viewers have found the session very helpful, and thank you so much for
Thank you.
your time. And it was
Yeah,
delightful.
thank you, Ipka, for this opportunity, and thank you, Ms. Mona Sharma. Thank you. Yeah,
And
it was a
also,
lovely session.
thank you to the viewers for joining us today. And I hope, doctor, if you have some time in future, we can connect again and bust more myth and fact around skin and hair condition. Until then,
Thank
please
you.
take
Thank you
care of
very
yourself.
much.
Have a nice day.